My name is Richard Bergström. I'm Director General of EFPIA, representing the research-based pharmaceutical industry. In the last few months, we've seen a sea change, growth in the future, and we cannot only save our way out of this. Viehbacher, CEO of Sanofi, was yesterday elected as president of EFPIA for the following 2 years, and he's going to give us his address about what he wants to do with EFPIA under his leadership, under the theme Health and Growth, the way out for Europe, innovation-led growth.
It's going to be interesting times over the next 2 years. We'll be electing a new European Parliament. We'll see a new Commission in 2014. And of course, we are in a macroeconomic environment that is anything but easy. Europe is probably in one of the most difficult situations compared to any of the regions where most of our companies do business. We are not just selling any good. We are selling medicines. And medicines obviously are not only seen as a social good, but in many cases part of a basic human right. At some point, we need to put our industry, first of all, into a different context and really demonstrate how this industry could actually enable some of the growth which is going to be needed if we're really going to get out of our situation. If Europe is going to succeed, I think we need to choose which of those industries we are best suited to compete in. We are not about to abandon all of our social models in Europe. We'll probably have to adapt them. But if we're going to have that kind of a value system, we're going to have industries that are actually able to afford them. And I think you're only going to do that if you're into higher value-added industries. And this is where I think the biopharmaceutical industry plays a major role. Europe tends to be a region where governments pay most of healthcare spend. If you're short a few euros at the end of the year, the easy target to go after is of course the medicines bill. But when you actually look at it, it makes no sense to go after that. First is that when you actually look at the rise over the last 10 years of the medicines bill, it has actually risen less quickly than the underlying demand for healthcare. So in other words, there is an inherent productivity benefit coming into medicines, partly because, of course, we know that the use of medicines can avoid other types of more expensive interventions. I think we can get better healthcare for less. And I say that because, first of all, we do not have healthcare systems. We have sick care systems. Our systems kick in when you're already sick. But 75% of healthcare costs are spent on chronic diseases, most of which are preventable. So as an industry, my first proposition will be, I think we need to enter into a dialogue with those who are managing healthcare. We have massive amounts of data and experience because of all of the research and clinical trials we do. And think about how do we work together to think about healthcare programs that could actually improve outcomes. We want to be a proactive force in actually understanding healthcare. Coming back to this notion of economic growth, those countries and those regions that invest in having universities that are world-class, that build human capital, that develop those industries that actually can benefit from that human capital and invest in innovation, will create that virtuous cycle that I think leads to higher value-added products. We are the most intensive sector of any part of the economy in terms of research and development, 15% of sales invested in science and technology. We have a burn rate of 30 billion euro a year. And we have to try to understand if we're going to put at risk 30 billion euro a year for the next 10 years to come up with the new products that we want to launch in 2023, are we able to say with confidence how those medicines will be valued today? Whether or not the healthcare systems will be sustainable to actually be able to afford those medicines. There's a huge amount of risk in what we do, and the profitability of our industry was really a benefit of what we did in 2003. We need to be able to tell our story. We need to be able to explain to stakeholders why it is our industry is so effective, and the only people that can do that is this industry. And so we understand that we have to be better ambassadors, better advocates for what we do. And that's my principal objective as the incoming chair of EFPIA. Thank you very much for listening.